Veronica, our last guest is Chris Trudeau. He's an associate professor of law, University of Arkansas Little Rock, the Bowen School of Law, and at the University of Arkansas for Medical Sciences. Welcome to the show, Chris. It's great to have you here.
Yeah, thanks for having me. I'm a Michigander by nature, so I'm happy to have to be part of this.
Oh, it's great to have you here. So, we're going to talk to you a little bit about health literacy. And that is so important right now, Chris, because some people think that they know what's going on with regard to COVID, but maybe they need a little bit more work in the health literacy world. So, kind of explain what it means to be health literate.
Well, it's a really broad concept, I mean, it's how people obtain, process, and use information in order to make health decisions. And of course, with the pandemic, that's put everything on, kind of under a microscope about how we're doing things. Because everybody, even if you think about it, even providers and researchers had to learn about this. This wasn't a thing, a little bit over 2 years ago. So everybody's ability to process and new information and then make decisions based on it has been evolving over time. And so I hate to think about silver linings through the pandemic like this, but this has been the case study of case studies in terms of how is our communication processes working. How do we get people to take a new concept and understand it and then act on it in order to benefit themselves, benefit their loved ones, benefit their constituents if they're government employees or politicians or something to that effect. I mean, it goes on and on.
Well, Chris, there's a lot of information out there right now, misinformation, I
Right.
should say,
Right.
about COVID 19, and vaccinations. So, how do you combat that? How do people sort through everything and figure out what is the truth and what should they do?
That is the tough part, right? I mean, that's where I'm on the National Academy of Sciences Roundtable on Health Literacy, and one of the things we've been doing the last 2 years really is having sessions on misinformation and how to combat that. And that is the tough thing. It depends on who you are, right? If you're a provider, you hopefully have patients who know, like, and trust you, so that way you have a little bit more credibility when you're trying to explain certain things. But then again, you hear things, a lot of the noise, like you mentioned, a lot of this misinformation from, be it from the internet or from just friends of family, through this kind of this cascade of information flow that kind of contradicts you. Oh, I heard Dr. So-and-so isn't getting vaccinated, or nurse so-and-so said, oh, this is crazy to get vaccinated. And that's the problem, is when you have these folks who have this perceived credibility, um, giving information that might be different than what your normal trusted providers are providing you. That it's normal to cause doubt. So, I mean, people always say, well, you should really just trust in people. We've had misinformation from everybody from, the person on the street all the way up to the CDC. And with the CDC, I don't really think it's misinformation. I just think we're learning as we go. And that's been the problem, right? Is we didn't know anything about this. And so I kind of differentiate kind of this learning where we once thought it was like this, but now it's like this, versus just kind of wholesale, letting kind of your inner emotions kind of drive what's happening, rather than science and kind of what we're learning through through day-to-day activities of life and science and research and those type of things.
And this is something that Veronica and I talk about all the time on this show, trying to make sure that we follow the science and we're smart about what we
Right.
do, both for ourselves and our children. Veronica, I know you've got some questions about this for Chris.
Chris, what we understand is that this virus is disproportionately impacting people of color. And I want to understand if health literacy is contributing to this disproportionate impact.
Well, I think it is in some ways. I mean, I think health literacy is not is colorblind in many ways. I tend to think of it as situational, because if I'm a lawyer, so if I go in and I've just been diagnosed with cancer, Well, I'm not going to understand the next 10 things that come out of your mouth because I just got told I had cancer. And even though I might have the ability to process and use that information once you tell it to me, the situation that I'm in is difficult. And so when you think about anybody, whether we have a lot of, rural communities here in Arkansas as well, that not only, of all colors, in all shapes and sizes, basically, and they're all struggling, so, but I do think the problem with that, historically, is that is that there has been the lack of trust um, in the healthcare system from folks who have been marginalized over the years. And so now you're asking them to, basically just put this blind faith in you when that's not what their ethos has been over time, because they've been, um, they have been kind of the subject of, clinical trials that have not been, where they haven't been truthful, like the Tuskegee syphilis trial, our clinical trials and those type of things over the years. So combating that trust is a real difficult thing to do, whether it be rural Michigan, rural Arkansas, no matter where, or even urban areas, of course.
And so one of the tactics that is being used to try and improve vaccination rates is to get community leaders to talk about this vaccine, the importance of this vaccine, and to educate. Is that an effective use
Yes.
of resources?
That is, because even before this, that's what we always said. Because one of the things I do here at the medical school is try and get diversity of enrollment in clinical trials. So whether it be like a new cancer trial or, trying a new cancer drug or something to that effect, you still want, people from all different parts of the population. And that's one of the things we've been doing for years is kind of what I call churches, barbershops, and beauty parlors. If you can get those trust, because those are the places people go, they congregate, they tend to kind of, whether they tend to respect what they hear in those places. And so if you can be in the community and have those community leaders that people know, like, and trust, conveying this message, people are still going to do what they're going to do, but you're going to get a much higher percentage of those folks doing that. We're doing that here in Arkansas now. You're seeing a lot of commercials or radio spots of whether sports figures, all different, people of all different types that have some clout in the community saying, I vaccinated, you should too. Basically, that's the effect of the message.
So when people have questions and they don't understand maybe the science behind this vaccine yet, and they're going to these facilities that have large turnover so that they can process the vaccine quickly, right? So you've got clinics, you've got pharmacies. What advice do you have for people to be able to have discussions about the vaccine, to get their questions answered?
Yeah, it's like you mentioned earlier, it's kind of like you have to shut out the noise and figure out who you're going to trust. It's almost like in some ways it feels really scary, even for me, it's like, okay, I'm just, because you hear all this misinformation. I tend to, like you said, follow the science. So even though, sometimes on the news you might hear some bad things said about the CDC and its response, they are the World Health Organization, the CDC. They're in it for everybody. They're not trying to fool you or hoodwink you or do those type of things. They care about everybody. So that's what I typically say is follow those major sources that have no incentive to try and tell you anything that's not going to help you and your community members and your family. And that's hard to do, of course, but that's the goal. Unfortunately, that's what the misinformation does, is it makes you doubt everything.
Yeah, follow the science, follow the good information. Thank you so much
Right.
for being with us.
Oh, happy to be here. Thanks for having me.
Chris Trudeau, Associate Professor of Law, University of Arkansas Little Rock, the Bowen School of Law, and he's also at the University of Arkansas for Medical Sciences. We really appreciate the advice. I have been trying to do exactly what you're saying, Chris. Pick somebody that I really trust in the scientific world, a doctor, and stay with it and follow that advice.
Well, thank you. Yeah, that's good advice.
You've been listening to Why I Vaccinate, presented by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas, and on behalf of my co host, Veronica McNally, thank you for listening, and we hope you have a great day.